Hi David, my name's Amy. I'm a physiotherapist. How are you today?
I'm good, thanks.
Good. Well, I understand you've been referred to phase 3 cardiac rehab
Mhm.
following a heart attack you had 6 weeks ago. So how do you think your recovery has been going so far?
Yeah, quite well, but I'd like to get back into exercise.
Oh, well, that's really good to hear. So I can understand after undergoing a heart attack, it can be quite difficult to almost know what to do with yourself, especially in terms of exercise. You might be thinking, will exercise cause me any harm? Should I be exercising? Shouldn't I? Or will things like lifting any heavy objects cause me any harm? Well, at this point of your recovery, it's important to realise that exercise is all right, and getting back into the routine of exercise will be really important for you. And making simple changes to your lifestyle will also be important to ensure what we call the secondary prevention of further cardiac events.
Okay.
So we don't want you to have any other heart attacks in the future. So at this point in time, you should be doing about 15 to 20 minutes of exercise daily. So that equates to activities like vacuuming and gardening, things like that. Or just 15 to 20 minutes walking a day. So I know you're keen on getting back into football.
Yeah.
So that's good to hear. Rehab will help you a great deal with your recovery and help you get back into your hobby. Because it gives you an idea of how you can exercise safely and effectively once you finish the program. So effectively what cardiac rehab does, it gives you the tools to go away in the long term and help you to feel confident and safe and effective with exercise. So I'm sure you're wondering what was meant by phase 3 cardiac rehab. So you'll receive phase 1 and 2 in the hospital, and the community nurse will also come out to see you at your house, and she will have reviewed you and give you what is called the heart manual. So the heart manual can be used for home-based cardiac rehab, or it can also be used to back up what we do here in the community cardiac rehab class. So it's just a booklet that gives you guides, weekly guides on different topics such as healthy eating, exercise, and it gives you a daily log of, you can write in the kind of amount of exercise you've been doing, and then it also gives you some tips on stress management, anxiety management, and also some relaxation tips. So I'll explain to you now what's within cardiac rehab phase 3 within the community, but ultimately at the end of the day it's your decision whether you'd like to participate in the programme. But I do believe it'll be really beneficial for you. So how do you think you'll feel about, coming along to a group and doing this kind of exercise?
Yeah, I think I'd like it.
Great, well that's good to hear. Working in a group will not only be beneficial for the social support, you can form relationships with others that have also gone through the same thing, and so that's also reassuring for you. But the good thing is for you is all your risk factors are modifiable, through making simple changes to your lifestyle, which you can do through cardiac rehab, because it'll educate you, and you'll also have some exercise in there that can all modify your risk factors for a further heart attack, which is really good news. So I'll tell you what's on the programme then. It's an 8-week programme. It's 2 sessions a week. One session will be an hour-long education and an hour of exercise. Then the second session of the week will be another hour exercise and then a bit of relaxation. So it's a roll-on, roll-off programme, meaning that different patients will be beginning and ending the programme at different stages of time. So I'll explain to you now a bit about what's in the education part and what's in the exercise part. So just to tell you about who's in the team, there's myself, physios, fitness instructors, specialist cardiac nurses, and there's also psychologists and dietitians in the team. So it's for patients like yourself, like I've said, who have had a heart attack, but also patients who have had stents put in maybe, or have undergone heart surgery, heart valve replacement surgery, or like a bypass surgery. So there's all various different patients under that cardiac patient umbrella term, but they're all at different levels of fitness and abilities and age groups. But although there is this variation, it's important to realise that you shouldn't compare yourself to anyone else within the programme. It's all about focusing on your own recovery. And by doing this, you will notice a difference not only in your own exercise ability, but your knowledge of your heart, and the benefits of making small lifestyle changes will all become apparent to you. So there is evidence out there just to show how effective cardiac rehab can be, not only for physical outcomes like reducing cholesterol and blood pressure, but also quality of life. So it can help stress management and anxiety and things like that. So within the educational component, there's going to be a series of talks from professionals. So physiotherapists, dietitians, nurses, pharmacists, and psychologists. So the physiotherapist will talk about the benefit of exercise and what we can refer you on after cardiac rehab. So that's phase 4. So that's kind of exercise classes that are available in your community, walking groups and aerobic exercise, similar to what you've been doing in phase 3, but just kind of carrying it on in the long term. Then dietitians will talk about how you can modify your diet. So they'll talk about low fat, low sugar and low salt diets and how important that is. Then the nurses will talk to you about what's happened during a heart attack, what's gone on, help you understand the biology behind what's happened in a heart attack. Then the pharmacists will talk about medication management to help you understand the kind of medications you're on and also the possible side effects of these, what's normal and things like that. The psychologists will talk about stress management, which I think could be very beneficial for you because I know you have a high level job. So, helping yourself to understand how to reduce stress can be really beneficial for you, which the psychologist will help you with that. And then the consultant cardiologist also comes in from the hospitals just to help you even further understand what, surgeries people might have had surgeries to help them understand that, or just, what's going on in a heart attack.
Okay.
So on to the exercise component then. So it includes a 10-minute warm-up, a 30-minute circuit-based exercise, which each exercise is 1 minute long within that. And then during the circuit, there's a 10-minute cool down after that. So during the circuit-based component of the exercise class, there's going to be a certain period of cardio exercises or aerobic exercises, and then some active recovery exercises in between that. So aerobic exercise include those that gets your heart rate increased and targets a main muscle group. So that might include things like squats, step-ups, knee lifts, hamstring curls. Then active recovery includes, using light weights for upper arm exercises. So that gives you a bit of a cool down between the cardio stations. But whenever you first come to the class, I'll go through every exercise station with you, just to ensure you know what's going on, you know the layout, and you're doing each exercise correctly and safely. So you'll discover whenever you come to the class that you'll be in a certain level. So all that level means is there's a specific ratio of cardio exercise to active recovery. So as you go up the levels, you'll find that you'll do more cardio and less active recovery. So that's just using more cardio exercises, increasing your heart rate just a bit more and getting you doing that for a bit longer. So everyone in the class will be in different levels, but there tends to be about 2 or 3 patients within the same level. So you'll all be there to, encourage each other and help each other out if you're struggling or anything. But as I said, all the team's there to always make sure you know what you're doing. So if you've decided this level through your pre-assessment we carried out, so that was your treadmill test, and that gave us an idea of your exercise tolerance. So it gave us an idea of your maximum heart rate, and you were able to target 85% of this, so that's really good for this stage of your recovery. So working at this level of exertion during cardiac rehab, working within this target zone which we've worked out for you, we'll monitor it through using a pulse oximeter, so that gives us an idea of your heart rate. So don't worry, we'll always monitor to make sure you're working within the correct zone, and that just ensures you're working your heart effectively. So whenever you're exercising at this level, you shouldn't be feeling so out of breath that you can't hold a conversation. It's just an exercise level that you feel quite sweaty, a bit breathless, but not so breathless that you can't hold a conversation. So we'll also monitor how well you're exercising through something called a Borg scale, and that's just a numerical scale. It goes up to 20, but during cardiac rehab we would like you to be exercising between 11 and 15. So that's just somewhat hard, and that's how you should be feeling throughout the course of exercise. But I'll show you the chart whenever you come to the class, and you can show me on a scale of how you're feeling during exercise. So just to finish off then, you come to the class in loose, comfortable clothing, and you bring your GTN spray for angina. So if you don't bring that, you can't exercise, so please make sure you bring that. It's going to be in your local leisure centre to avoid any difficulties with transport. And I also advise having a light lunch rather than a heavy lunch before you exercise. And also, we have water here. There's water stations, so you don't need to worry about that.
Okay.
So that's everything.
That's great.
Do you have any questions?
No.
Okay. Well, it was lovely to meet you, and I can't wait to start cardiac rehab with you. So I'll see you then.
See you then.